Okay, good morning, everyone. Welcome to our meeting today, and we have the opportunity to talk with the Global Fund, and we got a couple guests with us before us. We got Christopher Ben, who's with the fund, and we also got Sven Robinson, who's probably no stranger to most of us around the room. Welcome, gentlemen. Glad you could both be here. I just wanted to talk a bit about the Global Fund and the fact that it was established in 2002. It does great work with AIDS, TB, and malaria. I think a lot of us know that. Some of the things I think make it particularly interesting in terms of how it works is the fact that the Global Fund insists on country ownership, which I think is great, and partnerships, is performance-based, and then they work with all sectors of society. So I know you guys are going to touch on this, but I think it begs repeating over and over again that I think the work that is done through the Global Fund is very exemplary. The other thing is that I know there was a pledging conference in 2013 with over $12 billion that was pledged, and I know that Canada, since 2002, I believe, has pledged and committed over $2.1 billion, if I'm not correct. So I think that bears repeating. And our most recent pledge, I believe, was around $650 million for the coming years. So I know there's a lot of organizations that are involved. I know civil society is involved, and how decisions are made, et cetera. So why don't we just turn it over to you? You could give us an update on what's going on and some of the things that you're doing, and then we'll take some time to go around the room and ask questions and follow up in exactly what is happening with the Global Fund these days. So I'm going to turn it over to you guys.
Thank you very much, Honourable Chairman, and all members of Parliament and of this committee. It's always a special pleasure for me to be here with you. I've been able to talk to you several times and to update you on what's happening, not just on the Global Fund, but I think also on global health in general. And so I'm particularly pleased to be here with you this morning. And my first message is indeed one of great thanks to Canada, to its government, but also to you as parliamentarians for what you've been supporting over so many years now on global health. Canada has shown extraordinary leadership in global health, both on maternal and child health, and Canada is well recognized for that over many years through the G7 summits and their commitment to maternal and child health, but also to the Global Fund and therefore to the fight against the major infectious diseases, AIDS, tuberculosis and malaria. And let me also point out again how closely these topics are related, because still today HIV, TB and malaria are directly responsible for 1.1 million deaths among women per year and 1.2 million lives of children per year. So there's a very close link between the international efforts to improve the health of women and children and the efforts that we do in addressing the major infectious diseases. And in fact, you mentioned, Chair Ellison, that we had this replenishment meeting in Washington, D.C. that delivered a little bit more than $12 billion for the 3-year period, 2014 to 2016, that allows us to disperse about $4 billion per year. And roughly half of that directly goes into the health of women and children. So just to emphasize this very close link. And I want to thank you also for the consistent support across all parties here in Canada for global health. I've always perceived that this was very much a bipartisan issue supported by all of you, and I really want to thank you for that. And therefore, let's look a little bit at what has been achieved with this extraordinary support from Canada over the last couple of years. This is the year when the international community represented by the United Nations is reviewing the progress on the Millennium Development Goals. We will have the big summit in September in New York, and therefore it's important to take stock. And if you realize that, child mortality has now gone down by 50%. Over the last bit more of a decade. That is an extraordinary achievement that few of us working in the field would ever have thought would be possible. Similarly, maternal mortality has gone down also by about 50%. And if we look at the 3 diseases, AIDS, tuberculosis and malaria, you see decreases in infection rates and mortality also in the order of 40 to 50% across all these 3 diseases. When the Millennium Development Goals were established in 2000, it was perceived as a global emergency crisis because the numbers were going up and up. 6 million people are dying from these diseases every year. And now to be able to say we have not only halted and reversed these trends as we were mandated by the MDG summit, but that we can really see that we have decreases of 50% and more. That means we can approach also the phase of where we can credibly talk about defeating these three diseases over the next 15 years or so, once and for all, as public health problems. That is an extraordinary achievement, and I really hope that all of you who played an important role in that, you feel justifiably proud of what has been achieved with your support. And we should now build on that as we are entering, or we are already in this year that will be quite critical for international development. It's an extraordinary year if we are looking at the big events coming up. There is the Financing for Development conference in Addis Ababa in July that will set the scene for how the world will finance development over the next 15 years. Then the big summit with many heads of state, some say, the biggest assembly of heads of states ever in New York in September on the Sustainable Development Goals and how we kind of chart out the course forward to defeat poverty over the next 15 years. And also, let's not forget, all of that is also linked to climate change, and we have the big conference in Paris in December on climate. So this is a very, very critical year that is ahead of us. And when I look at global health, I see particularly extraordinary opportunities beyond what I just said. There has been a famous Lancet report that some of you might have seen. The big medical journal Lancet commissioned a study that included really all the best brains in the world on public health and finance. And they issued their Lancet report on global health by the year 2035. So they took a little bit the longer-term perspective. And they called this report the Great Convergence, because that's what it is about. We see now, after many decades, when health indicators between the poorest countries and the richest countries have grown, bigger and bigger. The gaps were getting bigger. Mortality was rising in the poorest countries, where we have, in the wealthy countries, quite sophisticated health systems, and life expectancy was going up. Now we see for the first time, almost ever, that this is approaching again, and that is fantastic news. Last year, World Health Organization issued a report saying life expectancy in the poorest countries, the low-income countries, has increased by 9 years over the last 15 years. That's extraordinary. And there are many African countries where life expectancy was going down, particularly because of AIDS, and we were worried about the stability of these countries. And now the World Health Organization can report in the poorest countries, life expectancy has gone up by 9 years. And by the year 2030, we can credibly talk about approaching, mortality rates for children and for adults, that there will not be this big gap that we've seen so far. That's not to say that the health systems will be at the same level. That's not possible. But you don't need these extraordinarily expensive and sophisticated health systems. What you need is, very simple but affordable and highly effective interventions that we now have that will enable us to achieve this great convergence in health. And from the Global Fund perspective, we are a financing institution, and we make these resources available for countries in need so that they can implement their programs on care, prevention, and treatment. But apart from the financial resources, we also look very much at efforts to make those programs more effective and to provide the kind of technical assistance and the innovation that will drive these improvements. And therefore, we've made innovation and the engagement of the private sector a key topic for the Global Fund for the next few years. And that actually matches quite well also with the agenda of the Honorable Minister Paradis, who also is talking a lot about, innovation and private sector engagement. In fact, I was with him in a panel at the World Economic Forum in Davos where we discussed that, and there was a special edition of Global Health Diplomacy that was, issued together with Canada, and we participated in that and published an article how the Global Fund is including the private sector and innovation in that. To that effect, we've created what we call an innovation hub, where we bring together many private sector companies from around the world, again, not to ask for the money, but to ask for their particular innovation that they can provide. And if linked with the resources that we provide, we will have so much more impact in the countries. And we are looking at issues like improving the procurement and supply chain management, the financial management, risk management, and overall the program quality. And we have already a number of very good examples where leading international companies are working with the Global Fund to making these programs more effective and more accountable, by the way, so that we can really follow the investments and measure the results and the impact. And in that context, we are also proposing what we call an e-marketplace. We want to, in a sense, innovate the whole way how countries procure essential drugs and health commodities, to make it simpler, to make it more transparent, and to make it cheaper. We have already, over the last 2 years, through innovations in procurement, saved about $300 million by purchasing bed nets, by purchasing AIDS drugs and malaria drugs, because we have a new way of procuring. But in the future, we are proposing an e-marketplace where, those countries and their ministries or their NGOs can directly access, online what kind of commodities they need, what kind of drugs they need, and access that at the best possible price at guaranteed quality. And that cuts out a lot of middle agencies, if you like, that increase the price and the complexity. And this is not proposed just for the Global Fund. This is for all agencies that want to participate in that, including bilateral agencies, multilateral agencies, other partners of the Global Fund. So that's one of the innovations that we are proposing and that we have been discussing with the Canadian ministry, because we feel there might be particular affinity, and we would be very proud if Canada would pioneer some of that with us and also communicate that with us in this very important development year. And you mentioned that the Global Fund is a key partnership where governments, private sector, civil society all come together at all levels, the global level, the country level. And we strongly believe that only that would be able to achieve these extraordinary results that we've seen, and to achieve even more in the future. So thank you very much for inviting us, and we definitely are very happy to engage in any questions you might have. And sorry, Sven.
All right, thank you very much. Why don't we, Mr. Robinson, you weren't going to say anything. You were part of the answer question. Perfect. Okay, Mr. Doer, why don't we start over you, sir? 7 minutes.
Just that you're in good company with gesticulating, because we had Bill Gates here, and one thing we noticed that his staff was sitting beside him, that we were concerned that they were going to get hit, because Bill Gates likes to do this, so you're in good company. Thank you very much. I think your overview, and as Chair Ellison said, the contributions that have been made and the efficacy of the work that's been done in the Global Fund has been something that our country has been proud of. I think it's been a great example of where we have worked together, all parties, multi-party, previous governments working together to support the Global Fund, mainly because of the approach and the way it was able to nail down some strategic goals and get funding and leverage funding and resources in ways we haven't seen before, and understanding that no one government can do it, and that not just government can do it, but working with civil society, private sector, and others. So it is a good story to tell, and I really appreciate the fact that you've come here on an annual basis to brief us up on what's happening. As Mr. Robinson will know, as members of Parliament, we can get distracted on other issues, and what's been a constant is bringing forward what the results have been for the Global Fund. So we thank you for your overview of what's been happening and the good work that's been done and the great results. And we heard this from Mr. Gates, actually, and with regards to polio. So some positive things happening. I want to talk about TB, and one of the Global Fund's supported programs, of course, is the TB Reach. And for those who don't know, it's just the idea of being able to detect as well as treat, and that's clearly important to be able to do both in the most vulnerable areas, the hard-to-reach areas, and the name says it all, TB Reach. And in 2010, our government was a great partner in this. It contributed a 5-year contribution of $120 million to the initiative. we're hearing, and I'm saying hearing, there's no facts in this, and I'm hoping we can clarify, but there's some question about that being renewed. So for us to understand as members of Parliament, certainly in this committee, what would be the consequence if Canada, and I hope it doesn't happen, didn't renew its contributions to that fund?
Thank you very much. That's an excellent question and provides me with the opportunity to talk a little bit about TB, which in some ways is a little bit the kind of most neglected of the three diseases. I think there's much more public discussion on AIDS and on malaria. TB REACH has been extremely important, not just for the Global Fund itself, but for the international efforts to overcome tuberculosis. Let me tell you why. For tuberculosis, in principle, we have a curative treatment, which is fantastic. That's what we don't have for AIDS, but we have for tuberculosis. There are challenges because there is increasing resistance to some of these standard treatments, but we know we have the drugs, we have the treatment. If it's followed, it's a cure. The biggest problem with TB is to find who has active tuberculosis, the active case finding. That's the most important challenge. And if we want to overcome tuberculosis, it's that challenge, particularly in vulnerable communities. People often do not come forward, to present themselves so that they can be diagnosed and then finally treated. And that's exactly what TB REACH does. So it helps enormously with the identification of the patients so that they can then be followed up and treated. Our great partners of the Stop TB Partnership, they call the biggest challenge the missing 3 million. Because we know every year there are 3 million people suffering from active tuberculosis who are not diagnosed. It's not that we could not pay for the treatment, they're simply not diagnosed. They're living somewhere in remote areas, in slum areas, in the big cities. Asia is a driver for this kind of tuberculosis. And TB REACH and the Stop TB Partnership are our key allies in addressing that particular aspect. So we would be very grateful if the support for TB REACH could continue. It's indeed, very complementary, if you like. Us paying for the diagnosis and treatment, but they helping to even reach the people. So full support for that, and thank you for that important question.
And I'm hoping, and maybe our friends on the other side will let us know where we're at, but we haven't heard whether the commitment's there, so we're obviously encouraging the government to follow up with the commitment to that important fund, as you said. Because right now, just give us an overview of what Canada's role is within that funding this initiative. We're a principal player, are we not, in terms of the TB REACH?
Yeah, you definitely are, and I think Canada has a great history in its support for tuberculosis. I'm quite aware of that Canada has played a leading role also in the establishment of the Stop TB Partnership and for TB REACH. I can't say, what's your share in that, but I believe Canada has been a major donor and supporter of that, so your contribution would be absolutely critical.
Chair, just finally, I note that after we've watched and witnessed Ebola and dealing with it, and this connects to TB, it's obviously about the medicines, but we have to have the resilience of the health systems. And I guess I just wanted to finish off my comments, because you're going to pull the plug on me, that we do understand that when we're funding these initiatives through the Global Fund, it's also about resilience in health systems and allowing people to get the diagnosis as well as getting the treatment. And so again, thank you to our witnesses. Thank you.
Thank you. Thank you very much, Mr. Dewar. We're going to move over to Ms. Brown for 7 minutes, please.
Thank you very much, and good to see you here again. It's, I think it's been maybe a year and a half since we saw you last, but good to have you here again. And you're right, Canada's doing great things. The $650 million that I announced in Washington a year and a half ago, we announced $500 million for the Gavi project. And so when you start to talk about convergence, it's all of these initiatives that we are seeing work hand in hand that are really going to make a difference globally. The reduction in maternal mortality, the reduction in infant mortality, the number of children. I said before that they're seeing 5 candles on their birthday cakes. They may not have birthday cakes, but it's that picture of seeing that number of children who are successfully growing and thriving, which should be an encouragement to all of us. And as you well know, the Prime Minister made that announcement of $3.5 billion last May in the summit for reaching every woman, every child. And that money is going to be dispersed from 2015 to 2020. All of the money that we had announced, the $2.85 billion that we announced in 2010, will all be distributed by the end of this fiscal year. So Canada has been very, very generous in its contributions, and I think we are now starting to see the convergence of all of these initiatives coming together, and immunization, the focus on nutrition, the new focus that we have on vital statistics. Every one of those initiatives going to help tremendously as we move forward. And I was really glad to hear you say, Dr. Ben, a new marketplace, because I represent the riding of Newmarket, Aurora, and I always think that it's wise to, to reiterate that. I was in Botswana a number of years ago, and I saw the allocation in their health budget to the initiatives for HIV/AIDS. And Botswana is one of the countries that has been severely impacted. And I understand that the life expectancy was 57 for males, 54 for females, and they knew that they needed to address this with some money put there very specifically. I wonder if you can just tell the committee a little bit about how health systems are working with you at the Global Fund to start growing their own substantial health systems that are addressing the issue, and how do you work with them on a financial basis to see that happen?
Thank you very much indeed. And it's great that you're mentioning Botswana as an example. So let me take that and answer your question through that. Botswana is one of the countries where I worked and advised, hospitals in Botswana before the Global Fund was created. In the years 2000, 2001, Botswana had the highest HIV prevalence in the world. You will recall, it was close to 40% of young adults were infected with HIV. It was an absolutely devastating situation. And I was in some of these hospitals where we introduced the first kind of antiretroviral treatment schemes, which was so urgent, and at that time it wasn't even clear whether under these conditions you could implement that. So that was a year or two before the Global Fund was created. Now Botswana, has indeed made tremendous progress on HIV. It was one of those countries where the life expectancy had gone down to like 35 years on average. And you mentioned quite rightly, it has gone up now again to 54 among females. So that's a tremendous achievement. And, with the investment over the years, they have really scaled up their health systems. The hospitals are in a much better, place now. And Botswana is a relatively wealthy country. It's an upper middle income country. They now don't depend anymore on Global Fund funding. So we are not financing the treatment anymore. We have over the years, but they are now at a point where their health system can support that itself. And I think that's a great achievement. And we do want to see over time that countries can graduate out of this international support if possible. And we see significant economic growth in many of also African countries. Botswana is just the kind of leading example, I would say. So we've always believed in investments in the health systems as we invest in these three diseases. It was never kind of something where we just deliver the drugs and then you take care of that. That does not work. Unless you have a workforce that is trained, unless you have hospitals with laboratories and outpatient and inpatient services, you cannot do that. Let's talk about the prevention of mother-to-child transmission, something that is very dear to Canada because of the Muskoka initiative. That requires that there are good antenatal services for women that they can attend and where they get tested and where they receive overall antenatal care. And if they show to be HIV positive, they receive also the treatment so that their babies will be born without HIV. That was an investment in the health systems, particularly for maternal and child health. So that has really been going on. Billions have gone in these health systems through Gavi, through Global Fund, through other initiatives. And there has been so much talk about Ebola, of course, over the last year, and it was a very dramatic situation. And there was a lot of criticism that the international response was late, and I do take that. But we should also not forget that many countries like Mali and Senegal and Nigeria and others, they were able to prevent any outbreak. They had early cases, and the health systems were strong enough to prevent that there was any further spread. And now we are grateful that also Liberia and Sierra Leone and Guinea, seem to be turning the corner on that. That is also because there has been significant investment in the health systems of these countries. Otherwise, they would not have been able to cope with that. And there were a lot of there are good studies now that show also the investment in AIDS, tuberculosis, malaria helped those countries to then also address the challenges, like through new diseases or other particular health challenges.
Thank you. That's all the time we have for this round. We're going to finish up this round with Mr. Garneau. 7 minutes, please.
Thank you, Mr. Speaker. Thank you for your testimony. You drew a very positive portrait of the Global Fund, and I'm delighted to hear that. I think we all, of course, support the work that is being done and the value of it. At the same time, it almost made me feel I really have no questions to ask because everything is going perfectly. However, in the real world, nothing is ever perfect. So I'm going to ask you to sort of reach down into the back of your head and tell me, is there one thing that bothers you, that keeps you awake at night more than any other with respect to possible areas of improvement that could be done with the Global Fund?
Mm-hmm. I can reassure you that there are many things that keep me awake at night. Also, I think I want to be clear. I mean, what I described was a very positive development globally, of which the Global Fund is a part. I did not claim that this was all just because of the work of the Global Fund. Mm-hmm. I mean, that is the work of an extraordinary movement over the last 15 years or so that has made that possible. And we've been privileged to be part of that. The challenges for an organization, if you're asking now, the functioning of the Global Fund as an organization, is still mainly this particular challenge that you want to have a light touch. We are still an organization that has no country presence. We have no country offices in all these countries. And still we want to make sure that our investment is reaching the people. There is a very high standard of accountability. And often we cannot really follow that through from our headquarters in Geneva to the last mile, as we call that. It's not so difficult to reach the people in the capitals and the big hospitals. It's very difficult to reach the people in the rural areas, and that's where in Africa still most of the people live. So not only to make sure that the most vulnerable populations get their services, but also our donors and like yourselves, you're expecting a certain level of accountability that we can tell you, how is the money being spent under those circumstances, and that is not easy unless you build up a huge machinery where you have your people everywhere. We think we found a way through engaging with partners at the local level, through engaging what we call local fund agents that we hire at the country level to kind of report to us. That helps. But there is always this kind of a dilemma, of a global organization that has the mandate to be light touch and keep the administrative costs down and still to be accountable for billions of dollars that you spend in many countries with very weak systems, not just health systems, financial systems. That's our challenge. And that's, by the way, where exactly we want to engage the private sector. We are working now with several of the most well-known international banks and insurance companies to help us to provide systems for these countries that provide better oversight, that they provide the teaching in financial accounting, in risk management that we can apply at a global level. But if you go to Ghana and to Uganda and Sierra Leone, that's where they can be very helpful because they have the staff on the ground and they have the expertise and the technology that can help with that.
Thank you. On a more just specific level, a couple of things I'm curious about. The medications that are used today to combat malaria, AIDS, and TB, are they still at the brand pharmaceutical level, or are they generic? I'm curious about that, and where do most of them come from?
Yeah. There we have to differentiate between the three diseases. AIDS, where the biggest budget is in terms of antiretroviral drugs, we purchase 90% of those as generics. And the bulk of that comes from India. India has a very vibrant generic industry with high quality, because it's not only the price, also the assured quality, and almost 90% of that we purchase in India. Some also in South Africa and other countries, but largely generic drugs. When you come to tuberculosis, the first-line treatment is drugs that have been used for decades, so they are all off patent and therefore relatively cheap. We buy, complete course of TB treatment for 6 months costs about $50. So that's, generic drugs, because there's no patent on these drugs. And the challenge is when you get to the more resistant forms. If you have to treat multi-drug resistant tuberculosis, then you have to go to new drugs that have been developed that are much, much more expensive, also more difficult to administer, and where we have to buy them from, research-based pharmaceutical companies. And in malaria, by the way, it's a mix. It's mainly, we get the drugs, the artemisinin combination therapy. It's still under patent, but we get it at a largely reduced price. So that's the tiered pricing that is coming in here. So it differs a little bit between the three diseases, but for the first-line treatment, we can buy them at very competitive price, largely from generic producers.
Okay. Okay. You mentioned that, if we keep the pressure on for the next 15 years, possibly we can bring these three diseases really down to a very low level. Recently, I read about a new strain of malaria that is supposedly challenging. I was wondering if that has upset the equation, if that presents a new and big challenge.
It's a challenge, but not that it would revise our predictions there. Malaria, among the three diseases, is probably the first candidate for elimination, because so many countries are in the process of eliminating malaria. And there are fantastic examples, countries like Sri Lanka that had a big malaria problem and are now reporting for 2 years in a row no malaria death at all in Sri Lanka for 2 years. It's a fantastic achievement. And I could tell you similarly, Eritrea and Vietnam and other countries are just on that same path. There is increasing resistance, and that is a concern. The resistance emerges usually in Southeast Asia, so it's the Mekong Delta, Cambodia, Myanmar, Thailand, that area. We are investing specifically there. We have a special program, $100 million is invested in the prevention of drug resistance, because you need to strengthen the local authorities to detect and address that. So we have a special program. We are working closely there with the Asian Development Bank and with the governments of those countries. So it's a concern, but not so much that we would say, oh, this is becoming so overwhelming that we don't think we can make that progress. No, we can probably. And it's a topic I would be surprised if Bill Gates didn't talk about that. I mean, there is a malaria vaccine on the horizon. I mean, more than on the horizon. It's likely to come out on the market maybe next year. It's not 100% effective, but it will be a very important additional tool. And with that, new vaccine, with the treatment that we have, we are still very confident that we can control malaria. And Bill Gates is obviously investing a lot there as well. And he's even more optimistic. He speaks about eradication. We speak about elimination, which is a slight difference. But in principle, we can make enormous progress with the tools that we have and a few new tools that are coming onto the market now.
Thank you. Thank you very much, Mr. Garneau. We're going to have time for one second round, so the full round. We're going to start with Mr. Hahn for 5 minutes, sir.
Thank you, Chair, and thank you both for being here. Just following on with, I guess, Mr. Garneau, about the systems, the accounting systems, the accountability systems in some of these countries and the billions of dollars we're talking about. Obviously, those are pretty attractive sums. How much of a problem is financial corruption? Can you put a number on it, grosso modo, about how much is at risk of going the wrong direction?
It is a problem for any kind of global donor investing money in these countries. I think all agencies, bilateral agencies or multilateral like the Global Fund, we've built up systems that enables us as much as possible to not only help them build the systems, but also detect when something goes wrong. We have, auditors in all these countries. That's what I call the local fund agents. And we have an office of the Inspector General who regularly does audits and investigations in these countries, issues reports. We make those reports public. There are constant kind of reports from our Inspector General on our website, so people can see where problems are being identified. And we do find, of course, that there is mismanagement if you look carefully enough. If you are asking me a number, if you add up the numbers from these repeated reports of the Inspector General, you come to a number of about 0.5%. That is,
it's actually pretty small.
Lost. Yeah, but it's significant money.
Yeah, it is.
It's significant money. Yeah. But you should also know that if we find that, we follow that. Yeah. In every single case, we go after the implement and say you have to repay that. That's what we call the recovery. So if you identify that loss, it doesn't mean that we just write it off. We ask them to repay.
Good.
And that does not happen always and immediately, but we can recover about 50% at least of what has been identified as loss. Sometimes it's politically sensitive. You're dealing sometimes with political leaders. There have been court cases in these countries, but we do follow up on that.
Okay, that's good. I want to talk a little bit about cultural/religious challenges in some places. A little while ago, I was fortunate enough to spend some time in Tanzania with a great organization called Results Canada, who in fact are sitting behind you in the room. And one of the things that was interesting to me was, we're talking about the diseases and TB particularly, but also HIV/AIDS. And one of the things that we heard was that there is no connection between HIV/AIDS and homosexuality, because homosexuality is illegal in Tanzania, therefore it doesn't exist. How much, using that as an example, I guess, how much challenges are in some parts of the world with sort of religious and cultural barriers to understanding the reality? How much of a challenge is that in some places?
It is quite a significant challenge. Homosexuality, is strongly discriminated against in many countries, particularly in Africa. And it becomes particularly difficult if then some countries issue legislation, as you probably have followed, where they criminalize, homosexuality. We had the examples of Uganda, Nigeria, and others, because then basically you drive, a certain part of the population simply underground, and they will not even access prevention and services and come forward for treatment, and you make the whole problem much worse. So that is a significant problem. The Global Fund has a role here. We always, talk to those governments, but we do that in a diplomatic way, because anything else will be interpreted as kind of, Western dominance and so on, and we have different cultural values. So you have to do that in a very sensitive way, but we do engage those governments and point out that this is not just a human rights issue, because there they say, don't teach us about human rights, but it is a public health issue at the same time. So, and that often, you can maybe make that point more clearly, that you say this does not make sense, from the public health point of view, if you discriminate a significant, part of your population. So we always try then to make those points, but we do understand these are deep-seated cultural prejudices, if you like.
That's all the time we have.
If I could just add one quick point to that, there is an important role here as well for parliamentarians to play on this question, because there are a number of international parliamentary organizations, whether it's the Interparliamentary Union, the Commonwealth Parliamentary Association, the OSCE Parliamentary Assembly, in which you have an opportunity to engage with members of parliament from some of these countries, like Tanzania, Uganda, and others. And I found, and my work with the Global Fund is trying to promote that engagement among parliamentarians. You can make a real difference just by raising some of these issues in a respectful but clear way with parliamentary colleagues at the international parliamentary level as well. And that's an area where certainly I know the former Foreign Minister John Baird really deserves credit. He really reached out not just to parliamentarians but to other government ministers and leaders as well. And Canada has really shown some leadership in that area, which you as parliamentarians across party lines can also promote in your work at the international level. Just wanted to mention that as well.
Thank you. Thank you very much, Mr. Robinson. We're going to move over here to Ms. Moore for 5 minutes.
Merci. Thank you. I'd like to talk more particularly about resistance to certain TB and malaria medications. Now, there is more and more resistance to chloroquine and other drugs. Oh, do you understand?
Very good.
Okay, you can start. Okay.
I did not get that first
So we'll
because of my
repeat.
poor French, but also because it was not very loud.
We'll
so.
get her to repeat. Sure, absolutely.
Donc, mes questions portaient
So my question dealt more specifically with drug resistance for TB and malaria drugs. For example,
Get maybe the volume needs to be turned up on us. Sure.
Got French.
Oh, you got French. Okay. It's been that long, eh? Try it.
Go ahead, start again.
Est-ce
We'll
que
make sure the
maintenant,
translation's working for you.
vous avez la traduction?
can you hear me now? Can you hear the interpretation? Can you hear the interpretation now? Great. So my question dealt more specifically with drug resistance, particularly for TB and malaria drugs. For example, we know that in Africa there's a great level of resistance to chloroquine, and particularly for very mortal diseases. So there are also problems with drugs in terms of false medication, and also the fact that people don't necessarily take all of the drugs to the end of the prescribed treatment. So there are also foreign workers, including Canadian workers, who go to Africa and do not necessarily take all of their preventive drugs because they don't like the side effects of the drugs. So that can also contribute to this resistance. And unfortunately, because often the fact that new drugs are created to fight against certain diseases might not be profitable, because many of the clients do not have the money to pay for patented drugs, there is not a lot of research done to develop new drugs to fight TB, for example. So it can be difficult to ensure that someone will really continue to take the drugs for 6 months, for example, without having to stop or interrupt the treatment, or without thinking, oh, well, now my child is sick, so I'm going to give my child half of the pills to treat my child. Now, how does the Global Fund deal with this problem of the lack of research, deal with this problem of resistance, particularly for TB and malaria?
Sorry that I didn't get your question in the first place. Yes, the whole question of resistance is a very important one. And in your question, you mentioned several challenges. One, there is real kind of criminal activity in some places where, you know, they produce fake drugs that are then brought onto the market. This is clearly criminal. And that is, by the way, one reason why we have this emerging resistance against malaria in Southeast Asia, because the background is often, you know, that you have fake drugs that are brought onto the market there, which leads to incomplete treatment and the development of resistance. We actually have, and that is, you know, Global Fund together with WHO and with many other agencies, and actually also agencies like Interpol, we have a global steering committee on exactly that issue of fake drugs and the criminal activities around that, because that's beyond the Global Fund what we can do ourselves. You know, here you need really law enforcement, you know, agencies at the country level, at the international level, that will address that. But this Global Steering Committee does exist, and it is currently chaired by a representative of the Global Fund. So that's particularly, I would say, relevant for malaria, because there is a big black market for malaria drugs. For tuberculosis, it's a little bit different, because, as I said before, the standard tuberculosis drugs, I mean, they're all kind of drugs that, you know, have been discovered 40 years ago. They're off patent. There's not much gains, if you like, you know, in the black market for that. The reasons for drug resistance there is more people in institutions, incompletely treated. Eastern Europe, Central Asia is a big area where you know, you have emerging TB resistance, even more, I would say, than in Africa, for example, where the experience with our TB programs is relatively good. We call a good outcome if 75 to 80% of the people who are started on TB treatment finalize that. That means they're really cured after 6 months, and that's the best way to prevent TB drug resistance. Complete and effective treatment. The issue is often more social, if you like, and that's why you have that, particularly in Eastern Europe. In prisons, for example, are a big breeding ground for TB resistance. Yes, we do need more research. TB has been completely neglected, I would say, in terms of development of new drugs. Recently, that has changed a bit. There are now 2 drugs that have come to the market, and that's the first time for over 30 years that we had, you know, really new drugs that we can now use for the most dangerous drug-resistant forms. We would never use that for standard treatment. You have to be very careful with these new drugs that you use them only where appropriate, so that you don't get resistance to these new drugs, but they are now available. You're absolutely right. Research into TB and other neglected diseases is very necessary. The Global Fund itself does not invest in research, we have to say. That's much more the role for the Gates Foundation and government entities to do so. But we have, of course, what we would call a pull factor. I mean, we incentivize research because the companies know if they develop these new drugs, there is an organization that can then pay for that. So that has an effect. I think that's a pretty good collaboration between the Gates Foundation, Global Fund, and others, that now we see more research into that, also into the more resistant forms on all 3 diseases. But it is, you know, a very important aspect, and particularly, as you mentioned, the malaria drugs, how we can address that together with governmental and law enforcement institutions in those countries.
Thank you. Thank you very much, Ms. Moore. We're going to finish off with Mr. Trache, sir, for 5 minutes.
Thank you, Mr. Chair. Thank you for being here today. One of the core principles of the Global Fund is performance-based funding. And I think that's a very strong, it's a very powerful message to send. And there's billions of dollars being spent, and I think it would be helpful for people. Ultimately, it's not countries contributing to the Global Fund, it's actually taxpayers, and it's helpful for them to have it at a more tangible level. You know, if you could pick maybe 3 countries to help people understand how this performance-based funding would actually work in practice, and maybe pick a star country that has shown incredible performance in some of these measurable things like HIV infection rates or malarial infection rates, and maybe a kind of a typical country, and then maybe a country where they've just not shown the performance. And then what is the mechanism that kicks in if they're not demonstrating the performance? How does the Global Fund deal with those? And I guess in the case of a country that has been a star performer, does the funding disappear, or does it focus on something else, maybe more prevention as opposed to treatment?
Yeah, thank you. Great. So let me think of 3 examples, because indeed then you will also see that the method of results-based funding will change, you know, depending on the situation. You're right, the Global Fund has always said we are a results-based funding organization, so that applies across the whole portfolio. But then the capacity of the countries varies, and one of the very clear top star performers has been Rwanda for many, many years. You can see that from the results. It's quite outstanding. I mean, you know, there you have a coverage now of AIDS treatment, malaria treatment, mosquito nets, 90% across the whole country. Fantastic results. But not only that, they have the systems with the accountability where you can have the trust that they use that well. That allowed us to change our whole funding model and to take results-based funding to the extreme. Rwanda now gets paid for results. That's new, kind of. You can't do that everywhere, but Rwanda, basically, you have a contract. You say, these are the results that you're going to achieve, and we pay you for verified results. That cuts out a lot of kind of bureaucracy in between, and Rwanda can do that, and they are a pilot for us where we can do that. And we are now exploring that with other countries like Ethiopia that are also very high performers, and where we can probably, apply the same method. Another country that has done very well and is now graduating is Thailand, for example. We've supported for many years, good results, relatively good health systems now, and they indicated this is the last replenishment period where they are expecting funding from the Global Fund. From now on, we can take care of that. Our systems are strong enough, and we don't expect funding from the Global Fund. I think another very good example, obviously we're happy to see if countries, can graduate out. And then you would have countries at the other end of the spectrum, and one extreme, I would say, is, let's say, South Sudan. The new country, extremely weak systems, where you could not practice what we do in Rwanda in that sense, where we really have to make sure that we follow all the disbursements to the level. We cannot even disperse to the government. We usually use UN agencies or international NGOs in that sense. Sometimes the Red Cross, so they are our partners on the ground. It's still results-based funding, if you like. I mean, we agree on certain targets and we hold them accountable for that, but it's much more hand-holding, right? We cannot just say we pay you for the end results. We have to, follow every step on the way. So that would be the spectrum, if you like, between the extremely high performers, Rwanda, Thailand, Ethiopia. Then in the middle you would have, the Zambias and Tanzanias and Kenyas. And then you have the really very fragile states, very weak systems, Chad, Central African Republic, South Sudan. And we have the challenge to adapt in our systems so that we still achieve results, but with different levels of oversight and accountability mechanisms.
Could you describe in South Sudan what has been the trend with infection rates in South Sudan in, say, the last 15 years? You're saying they're still getting results. Is it? I don't know if you have the numbers at your fingertips or some illustrative notion of what's happening with infection rates in a country like South Sudan.
Yeah. It's still achieving the results, that is true. Particularly malaria, I would quote, because we have had some successful bed net distribution campaigns, and that's not too difficult. You don't need an elaborate health system for providing, communities and villages with bed nets, and that has an effect then on malaria, and we've seen that. It's much more difficult when it comes to, let's say, TB treatment, AIDS treatment, where you have to follow up over months and sometimes years and establish systems. Even that is happening. I'm not saying it's not happening at all, but it's much more difficult also because simply the logistics, the roads are not there. You cannot reach many areas. You have rainy seasons where full parts of the country is blocked. We then try to work with these partner agencies like the Red Cross, like UNDP and others who might have access to these regions that they help with that, sometimes with international NGOs as well. But that is a kind of logistical nightmare sometimes under those circumstances. But still, I would claim, some reasonable results are achieved also in those countries.
Thank you. Thank you, Mr. Trottier. And to our gentleman here from the Global Fund, thank you, Dr. Ben, for being here, and Mr. Robinson for you being here as well. You have lots of hardworking civil society organizations that are always talking to us as members of the importance of what you're doing. So you've got good partners all around the world. So thank you very much. With that, I'm going to suspend the meeting, and so we can get set up for our next meeting. Thank you. Okay, welcome everybody, and pursuing to Standing Order 1082, our study in the situation in Hong Kong. I would like to welcome and take the time to welcome Martin Lee, who is with us today, and I want to thank you for taking time to be here, and also to Gloria Fung, who's also with us as well. Gloria, you're with the Canada-Hong Kong link, I believe, so that's great. And I know, Mr. Lee, maybe you'll tell us a bit more about yourself, but I know that you have been a lawyer, you've been a legislator, you've started parties, you've been involved, and you've been very active on the human rights front. And I think for my colleagues, just to mention very briefly that as far as being a champion of human rights, Mr. Lee has received numerous awards. I know he's received the 1995 International Human Rights Award by the American Bar Association, the Prize for Freedom by the Liberal International in 1996, the Democracy Award by the United States National Endowment for Democracy, and in 1997, the Schuman Medal in 2000, which Lee was first non-European to receive the European People's Party and European Democrats. So very much involved in the champion of human rights. We're looking forward to us giving us an update on what's going on in Hong Kong these days. After you've had a chance with your opening statement, then what we'll do is we'll move around the room and have our members ask questions and find out more information. So welcome, Mr. Lee. We're glad to have you here. I turn the floor over to you for your opening statement.
Thank you, Mr. Chairman, and thank you, honourable members, for having us. And thank you, Mr. Chairman, for the wonderful weather you have organized for us. Hong Kong is at a crossroads. If Hong Kong can proceed from now, according to the blueprint laid down for Hong Kong by Deng Xiaoping in the early 1980s, Hong Kong will have a bright future, and I dare say so will China. But if Hong Kong were to go down the slippery slope as now, Hong Kong will become soon just another Chinese city. So this is a very important point in our history. 18 years after the handover of sovereignty on the 1st of July, 1997. I have prepared a short brief for you, Mr. Chairman and honourable members, so I won't go into that. But I think it is important to look at Hong Kong. We must do so in the context of China and in the context of Canada and China relations. I will start by saying that there is no inconsistency between a good policy for China and Hong Kong and your foreign policy of democracy, freedoms, and human rights. They are perfectly consistent. Some people think that if you want to have China trade, then you better be quiet on human rights issues and so on. Let me say that this is a wrong approach. China has no respect for any country which is in their pocket. China respects a government which believes in fairness. So the two things are not inconsistent. China trade and your concern for human rights and freedom and democracy for Hong Kong. We have been promised by China that we would continue to enjoy all our core values under British rule for 50 years from the 1st of July 1997 without change. But in order for that to happen, both the Chinese and British governments have agreed in their agreement called the Sino-British Joint Declaration that there would have to be a sea change in our political structure. Under British rule, the governor was appointed by the British government in the name of the Queen and sent to Hong Kong to govern us without any prior consultation with the people of Hong Kong at all. And once he got to Hong Kong, he would then appoint every single legislator in our legislature. And not only that, he would preside in all the Legislative Council sittings. So if any legislator were to appear to him to be troublesome, that guy will not be reappointed. So that system, that colonial structure, had to go according to the Joint Declaration, which prescribes that we would have an elected chief executive and an elected legislature. That is the only way I would submit that Hong Kong people could really rule Hong Kong with a high degree of autonomy. And these are the words used by Mr. Deng Xiaoping when he said one country, two systems. But how could Hong Kong people rule Hong Kong with a high degree of autonomy when the people of Hong Kong don't even elect their leader and all members of the legislature? That is the problem. Now, the basic law, which is our mini-constitution, in fact spelled out these promises of elected government in the Joint Declaration in much greater detail in the basic law, providing that 10 years after the handover, that is, by 2007, we could have an elected chief executive and all members of the legislature. And so we patiently waited. Beijing said no. So we waited for another 5 years, we thought, hoping that by 2012 we could have it. Beijing said no again. And we had to wait until 2017, so said Beijing, before we could elect our chief executive by universal suffrage. And if that went through successfully, we could then, in 2020, elect all members of our legislature. Unfortunately, after 10 years of waiting, Beijing decided on the 31st of August last year that although Beijing would certainly allow Hong Kong people one person, one vote in the election of our next chief executive in 2017, when it comes to the nomination process, Beijing would call the shots. In other words, Hong Kong people would only be able to elect among 2 or 3 candidates, all of whom will be pre-selected by a Beijing-controlled nomination committee. In other words, Beijing will pick puppet A, puppet B, or if we are lucky, even puppet C, for us to elect. Such a type of election certainly doesn't come within international standards. Of course, in Hong Kong, the Joint Declaration already prescribes that the International Covenant on Civil and Political Rights applies to Hong Kong. And basic law, our Constitution itself, prescribes by Article 26 that all Hong Kong permanent residents have not only the right to elect, but the right to stand for elections. So what was decided by Beijing last year was clearly contrary to all these promises. In fact, it is also unconstitutional, but I will not go into that until perhaps you ask me questions on that. It would take me too long for that. Now, so how do we go from here? The democratic camp of legislators, who amount to more than 1/3, have vowed that they would vote against any bill proposed by the government, which is within the confines of the decision in Beijing on the 31st of August. So if they restrict Hong Kong people's right of nomination of the candidates in 2017, these legislators will vote against it. Now, this particular bill under the Basic Law requires a 2/3 majority, a special majority of 2/3 of all the legislators before it could go through. And we have more than 1/3. So we could block it. Now, are we going to block it? And if we block it, what happens next? Everything remains to be seen, because it would depend on the paramount leader of China, Mr. Xi Jinping. He has been seen to be amassing power unto himself. He was described by the Time magazine last year as Emperor Z. Now, if he really wants power for the sake of power and to become an emperor, Hong Kong will soon become a Chinese city. But if he should prove to be a reformer, having got power unto himself, then there is hope for China and hope for Hong Kong. And I hope the Canadian government and the Canadian Parliament will speak up for us at this difficult stage. You have every moral obligation to do so, because Beijing, in fact, appealed to your support when the Joint Declaration was first announced. Beijing wanted the world to support the Joint Declaration between Britain and China, because Beijing was afraid that there will be too much emigration from Hong Kong if Hong Kong people have no hope in their future. So the Canadian government, having been lobbied successfully by China to support the Joint Declaration, certainly owes a moral obligation to the Hong Kong people when things are going wrong. You cannot be accused of interfering in China's internal affairs because China had lobbied for international support. So I would leave some time for my colleague.
Mr. Chairperson, honorable members of the Standing Committee, thank you very much for giving us this chance to testify on the critical situation in Hong Kong and also the importance of protecting democracy, autonomy, and also rule of law in Hong Kong, which has a very deep and close connection with Canada. Supporting the people of Hong Kong in defense of their human rights and also democratic rights is vital in building strong and respectful foreign policy in Canada. Canada has a stake in the current crisis in Hong Kong for 4 reasons. Number one, as one of the countries endorsing the joint declaration signed in 1984, Canada has a moral duty to urge China to respect and honor what they have promised to Hong Kong people in respect to one country, two systems, Hong Kong people ruling Hong Kong with a high degree of autonomy. Number two, democracy, freedom, and rule of law are the bedrock principles of our foreign policy. We are morally obligated to defend these basic civil rights of the Hong Kong people. Number three, it serves our national best interest to defend the rights of our Canadian citizens living in Hong Kong. Hong Kong is Asia's most Canadian city, with its 300,000 Canadians and also over 200 Canadian companies based there. Hong Kong is Asia's 3rd largest financial market. Without the rule of law, freedom and civil liberties, there won't be any guarantee of a level playing field for Canadian-owned businesses or personal security for Canadians in Hong Kong. Number four, there are very strong people-to-people ties between Hong Kong and Canada. Last year, numerous community organizations, student groups, and national organizations have rallied to show their support to Hong Kong. The all-party motion of the House of Commons calling on China to respect international agreements are not only well received by Hong Kong people, but it will also have a positive impact on China in the long run. But we all need to do more at this critical time, with the people of Hong Kong threatened by ongoing erosion of their basic human rights. We therefore respectfully recommend, number one, that the Standing Committee undertake a full study of the critical situation in Hong Kong and submit a report to the Parliament to serve as reference in the formulating of government policies on this issue. Number two, the Government of Canada issue an official statement urging China to honor and respect commitments to the Joint Declaration and the promise of universal suffrage to Hong Kong people before the Chief Executive election format is decided by the Legislative Council of Hong Kong by mid-2015. Thank you very much.
Thank you very much. Now we're going to start our first round with Mr. Dewar from the NDP. 7 minutes, please.
Thank you, Chair, and thank you to both of our witnesses for very clear, concise statements. I just want to start, Chair, by acknowledging the recent work of the UK Parliament, who recently just tabled a report in the UK Parliament. And I just want to read what the report said, and it's relevant to our discussions today. From that report on Hong Kong, They said the preservation of both the letter and the spirit of the joint declaration is crucial to Hong Kong's economic and business success. Recent debates over electoral reform have exposed deep divisions in Hong Kong and a wide divergence of expectations for its political future. In addition to debates on constitutional reform, we heard widespread concern that the autonomy, rights and freedoms guaranteed to Hong Kong in the joint declaration and basic law have gradually eroded in recent years. A free press and the right to demonstrate peacefully are essential to the functioning of a free society and are among the most crucial pillars upholding Hong Kong's high degree of autonomy. I couldn't agree more, and I think what we've heard today, particularly Canada's role in acknowledging with our good friends in China the 84 process that led to the 97 agreement. And I want to state that we believe, certainly as the official opposition, and I think many of my colleagues around the table, that we have a critical role to play, as Mr. Lee stated, Mr. Chair. And that is that we need to see Canada being a responsible actor, having good relations with China. To say all we're simply affirming is what was agreed to, both in 84, in 97, and for the path forward. And I'm interested because Mr. Lee did say, Mr. Chair, that and acknowledged, which I think is important, the trajectory of this, a very similar history to Canada's history, you know, having a governor appointed and then appointees to a legislative body. We went through that in our history. But he also said something very important, Mr. Chair, and it leads to my question, is that Deng Xiaoping had been the, if you will, had the vision of this as leader of China. And it is in keeping with his vision that this agreement be honored. And so my question to Mr. Lee, through you, Chair, is we know that he's had pressure from officials, et cetera, and just recently, just this past Monday, for his participation in the democratic protests. But I wonder if you could tell us, Mr. Chair, what is happening on the ground with people in Hong Kong. It's been quiet for the last number of weeks, months even, and I'm wanting to get from him exactly what is happening on the ground. What can he tell us about how people are feeling and what people are doing to advocate for China and Beijing and officials to adhere to the commitment of both 84 and 97. Thank you, Chair.
Well, the Pan-Democrats in the Legislative Council have reaffirmed their refusal to vote in support of any bill which is going to be presented to the Legislative Council based on the 31st August decision of last year. And they have just affirmed it 2 days ago. And of course, as far as the university and secondary school students were concerned who participated in this beautiful umbrella movement, they are now all back to universities or schools, studying hard, I hope. Now, but these young people, having been baptized into democracy, have got in their hearts, each of them, the fire of democracy burning. And no iron fist is going to quench that fire in future. So that gives me great hope. Because instead of old people like me continuing to fight for democracy, now we have a totally new generation. And of course, it is Hong Kong's future. I remember in the early days of this movement, umbrella movement, young Joshua Wong, who just turned 18 at that time, said, I'm going to fight for democracy for me and my next generation. A young guy of 18, fighting for democracy for the next generation. And when I heard that, I thought to myself, I could now retire. Instead of me fighting for him, he's now fighting for the next generation. So, yes, things have quietened down, but everybody's waiting for the government to produce a bill to the Legislative Council, which is going to happen maybe within the next month or two. But the decision is going to be made in Beijing. Now, that is the all-important thing. Because if the Beijing leader, the paramount leader, Xi Jinping, were to say, if he has the wisdom and the commitment and the vision, he could well overturn what has been done during these 18 years. That is, of the Chinese government departing from the blueprint of Deng Xiaoping. He can certainly and easily bring us back to that blueprint.
Well, and if I may, Chair, one of the things that I find interesting is that, in fact, what has been laid out by Deng Xiaoping before and is an opportunity for the present government is to actually be more progressive and enlightened than the predecessors. Because, in fact, what we see is that this roadmap is allowing people to have a say, to vote, and the choice within, of course, and a really important underline here, the two systems, one country. So it is a real opportunity if the leadership chooses to embrace this. I just want, in the time I have, is how important it is, and maybe I'll just leave this as a statement, what we heard from Ms. Fung and from Mr. Lee, but is that this committee, if we can, to do a follow-up to this and to at least recommend to government what was recommended, and simply that our government express its commitment to the 97 agreement, and that we are seized with that as a committee, and perhaps we can follow up with that after. Thank you.
Thank you very much.
I'd like to add, some of my observation of the umbrella movement in Hong Kong. This movement has been joined by people from all walks of life, men and women, young and old. And the most amazing part is that a lot of young people have come forward to take ownership of the city. And we always say afterwards that Hong Kong is never the same as before. Just recently, Canada Hong Kong Link had organized a sharing with the student leaders in Hong Kong. And they told us that they have spent their future time in integrating with the grassroots and also educating the grassroots as, why it is so important for them to come forward to fight for genuine universal suffrage instead of, the handpicked electors by the Beijing government. And I think it's really good if the committee can organize a full study of the Hong Kong situation in the future so as to enable more representatives from Hong Kong to be able to share their views with all of you.
Thank you very much. We're going to move over to Mr. Han for 7 minutes, please.
Thank you, Mr. Chair, and ni hao and xie for being here. I've had some contact in Edmonton with the Hong Kong Canada Business Association. It's very dynamic and profitable organization for both countries. Mr. Lee, how much confidence or hope, realistic hope, do you have in Mr. Xi being the reformer that you hope he is? And can the opposition legislatures in Hong Kong, is there enough strength there to effectively at least vote against or try to block the legislation if he is not the reformer that you hope he is?
Certainly, the Pan-Democrats could block it. There's no doubt they could block it. We have enough votes. And at the moment, I don't see anyone going to the other side. Now, as to Mr. Xi, of course, nobody can be certain because he has been hitting these tigers, as we say in Chinese, these corrupt tigers. And these are real tigers. And so even he is finding it not an easy job at all, but he is hitting at corruption harder than any other of his predecessors. And the next thing he also did, which gives me some hope, is that he has just introduced a new state policy, which is to govern the country, to rule the country by law. Now, of course, it's not good enough for you and me, because we would have liked not rule by law, but rule of law. But at least is a starter. So I hope that he is a man of vision, and he could actually lead us back to Deng Xiaoping's way. Because, Mr. Chairman and members, I believe when Deng Xiaoping came up with this idea of 1 country, 2 systems, he did not mean it only for Hong Kong or Taiwan or Macau, but he also intended that policy to apply to the rest of China. That is why he said Hong Kong must keep what we have under British rule for 50 years without change, but at the same time having democracy to bolster these, to protect these core values. And he wanted Hong Kong to remain high, and he obviously reckoned that China would take about 50 years to catch up with us. And that is why he said 50 years. In fact, this was confirmed when the secret documents were released in Britain after 30 years. So there was a document recording a meeting between Prime Minister Margaret Thatcher and Deng Xiaoping in Beijing on the 19th of December 1984, exactly on the same day when the joint declaration was actually signed in Beijing. And that document recorded Deng Xiaoping's words. And it said, some Japanese friends asked, why 50 years? He explained to Mrs. Margaret Thatcher. He said, because we want China to be at par with the rest of the developed countries. And I reckon it would take 50 years. So he wanted China to go up. And of course, if you look at China today, there is no socialism being practiced there, or communism. It is capitalism. But in Mr. Deng Xiaoping's words, capitalism with Chinese characteristics. I'm sorry, socialism with Chinese characteristics. That means capitalism. All right? So he obviously was looking at Hong Kong, a Chinese city with the rule of law and all of human rights and a level playing field, corruption well under control. And he obviously wanted China to go down that route. That is why he sat down in this policy, one country, two systems. He meant it also for China to catch up with us. And that is why I'm confident that if Mr. Xi, the present leader, has got power into himself, has got rid of the corrupt tigers, hopefully he would go down the road of reform. And what better signal for him to give to the rest of the world that he means business, that he is a reformer, when he actually allows Hong Kong people to have democracy as it was already promised to us.
I couldn't agree more. And one of the things about things changing and people advancing and so on is that change, I think, probably has to come from within eventually in China, in mainland China. We spent some time in Taiwan last year, and one of the topics of discussion was what will it take to change China into more free market, freer society, and so on. And one of the comments was the more that Chinese people from the PRC spend time in Taiwan and Hong Kong and other places, the more they're going to demand the things that they see the people of Taiwan having and the people of Hong Kong having and the people of other parts of the world having. So what's your sort of assessment of, you said 50 years, maybe it's 50, maybe it's 100, but what's your assessment of the power, ultimate power of the people of China to change China from within, and somebody like Mr. Xi, seeing that coming and basically getting out in front of that parade?
Yes, it's quite right. When people are educated overseas, I mean, they see the world. I mean, a lot of Chinese students are studying here. They go back. And the important thing is any good leader of China, and I hope Mr. Xi is one of them, will see. All right, now China is now the world's second largest economy. But how do you sustain it without a corresponding political structure? How can you, after killing all the corrupt tigers, what do you do next? How do you keep the country free from corruption? You've got to have a system. In fact, Deng Xiaoping said it many years ago. When there is a good system, even evil men cannot do evil. But when there is no good system, even good men cannot do good, but may be forced to do evil. That good system, I suggest, must be a democratic system. So a good leader will say, okay, now that China has economic power, what's next? If you want to sustain it, he must make sure that China will go down the democratic way, like all the other countries in the world. And Hong Kong is just the best place to begin with democracy in China, because they have already promised that to us.
Thank you. Thank you very much, Mr. Han. Mr. Gardner-Su, 7 minutes, please.
Thank you very much for being here today to offer your testimony and to answer our questions. one question I have. In talking about the joint declaration as well as the basic law, the question of elections and of course the very big issue of pre-selection of candidates. Is there anything in any of the writing of either the joint declaration or whatever documentation exists and the basic law that spells out specifically whether or not the selection is based on a pre-selection coming ordained by China, or whether that detail was left unsaid?
Yes. Now, first of all, the joint declaration itself only talked about broad principles because it's an international agreement. But the joint declaration itself says quite specifically that China's basic policy on Hong Kong, which was already set out in the joint declaration, will be further set out in a basic law for Hong Kong, where more details were in fact given. So that in both Article 45 and Article 68 of the basic law, it is said that the election of the chief executive, Article 45, and the election of the entire legislature, Article 68, for both of these elections, the ultimate goal is to have universal suffrage. But Article 39 prescribes that the provisions of the International Covenant on Civil and Political Rights are to continue to apply to Hong Kong. And that covenant, of course, then sets out effectively that they will be elected democratically. And the basic law, as I said, itself, Article 26, says that all Hong Kong permanent residents would have the right to elect and the right to stand for election. And indeed, the United Nations Human Rights Committee has already ruled that the election has to be genuine and fair. And so there must not be too much unnecessary restriction to the right to stand for elections. Now, at the moment, what Beijing has said is they must love the country. The candidates must love the country. Well, it is a good thing. But how do you spell it out in the law? Who decides whether anyone of the ladies and gentlemen here loves the country or loves the country enough to be in China, well, of course, to be in Hong Kong, to be chief executive? I mean, and they will decide, oh, this guy is not a patriot. I mean, that restriction totally is wrong. So I think you look at the basic law, look at the joint declaration, and look at the international covenants, and together it has to be a meaningful election. Hong Kong people must be given a real choice. Now, the nomination procedure is prescribed actually in the basic law, Article 45, to say that there will be a nomination committee, broadly representative. And of course, the best and the most and the broadest representative way is to have all the members of the nomination committee to be elected by one person, one vote, which is an indirect type of election, as in the election of the U.S. president. So it's indirect. Now, I don't mind that, but it cannot be right that Beijing could effectively control the constitution of such a nomination committee. The Standing Committee of the NPC actually decided in this decision on the 31st of August last year that the nomination committee would consist of 1,200 people following the present election committee of the chief executive. And these 1,200 members would be elected in the same way as under the now existing system for election committee. That is, they would be elected not one person, one vote, but by functional constituency type of elections. Now, this is very old. I was told that Mussolini had it. Indonesia had it about 20 years ago. But Hong Kong is probably the only country which still has it. And so it's one lawyer, one vote, one engineer, one vote for some of those. When it comes to the commercial side, it's one company, one vote. So a rich man will have many votes because he's got many companies. All right? So this is totally unfair. And that is why I said in my opening that if we go down this route, the nomination committee will be controlled by Beijing. At the moment, if you look at the present election committee of the chief executive of 1,200, Beijing controls at least 950 out of 1,200. And Beijing decided last year that anybody who wants to be a candidate in the election of the chief executive in 2017 must have the support of at least 50% of the 1,200 members of the nomination committee. They control 950. How could we put up somebody with 600 votes? So that is why they want to control it.
Very quickly, two questions. Of course, we've seen the umbrella movement. It has been covered quite a bit in the news. And those are, from the appearances, a lot of young people, as you said, who may have been born after 1997 or close to there. How does the Hong Kong population in general feel about this issue? And secondly, apart from this issue, how would you describe relations between China and Hong Kong?
Now, this issue has turned out to be very divisive. And I would say it was because our chief executive, no doubt, at the direction of Beijing, wants to divide the community. For many, many years, even after the handover, the Hong Kong community is a very harmonious one. I remember, people will, yes, they belong to different parties like here, all right? But they're very polite, even though they don't agree with you politically. But this particular movement has resulted in the community being totally polarized. Because whenever the pro-democracy people hold a demonstration, Beijing will make sure that there is a counter demonstration. And it's documented in many press reports that these people were paid to protest against our protesters, all right? And then there's a scuffle. And so it's very divisive. But public opinion polls show that although a lot of people were inconvenienced, including me, when you go to work, I mean, you're inconvenienced because they were occupying Central, where my chambers are, and Causeway Bay and Mong Kok. These were busy districts. All right? So a lot of people were inconvenienced. But surprisingly, very few people were really very angered by these things. And the relationship between China and Hong Kong, in one word, it could be immediately improved if Mr. Xi Jinping were not only to give Hong Kong people the vote, but to give the Hong Kong people the right to stand for elections. It will be completely harmonized again.
Thank you. Thank you very much. That's all the time we have. We'll start one more round for 5 minutes. We've got three speakers here. Mr. Goldring, we're going to start with you for 5 minutes, please.
Thank you, Mr. Chairman. And welcome. Thank you for being here, Mr. Lee and Ms. Fung. And I suppose if we were to abide by the letter that was received from the Chinese ambassador, that perhaps we wouldn't be meeting here today. But fortunately, this is Canada. And I have a question along the line of the thoughts. And what I'd like to know, Mr. Fung, is what is Britain saying about this? Have they expressed any direct concerns, or are they involved in trying to bring about adherence to the original agreement? What have they been doing? Have they been communicating any concerns for this too?
May I take this one? The British government, until recently, has been very disappointing because it is a signatory. So it has every legal right to say to the Chinese government, hey, look here, what's happening? But they chose not to. And I have to say that their foreign policy on Hong Kong is simply, give us more China trade, please. Now, I choose words carefully, but I'm afraid that is how they have behaved in the past. But recently, Parliament, though, did the right thing. The House of Commons Select Committee on Foreign Affairs has just come up with a long report on Hong Kong. And in fact, it was referred to earlier. Now, I would urge honourable members to take a look at it. And it has actually criticized the British government at various places. And I hope that the British government will do the honourable thing on Hong Kong and not just think of its China trade. Because to begin with, as I said in my opening, the two things are not inconsistent. They are not mutually exclusive. If Britain were to honour her obligations and duties under the Joint Declaration and defend the aspirations of the Hong Kong people of democracy, which was already promised to us in the Basic Law, and there's no doubt in my mind that Beijing would respect them instead of treating them already in their pocket.
And with the legislation that's being proposed in the United States, how is that being received there? Is there any indication on its level of support that it might receive? And what are the specifics of it? What are they calling for?
Well, in fact, the legislation has yet to be produced. And this is why it's shocking. When no doubt some of you might have read the Hong Kong government's position and the Chinese government's position too at the moment, at least up to now, is pocket it first. Pocket it first, which is a Chinese expression, is not good enough. But you better take it first, rather than not to have anything. And half a loaf of bread is better than nothing. But how on earth can we pocket it first when I don't even see what it is? And yet they are so ridiculous to say, okay, now Beijing has already made these decisions. All right, in our bill presented to you in the near future, we cannot go outside that decision. But we haven't decided yet, all right? But please tell me that you're going to pocket it first. Now, once you say pocket it first, the obvious logical question is, what comes next? And they won't even tell us either. So why do I pocket it first when I don't even know what is to come later? So this is absolutely absurd.
With the agreement that was signed, were there not any specifics on a time frame? There were specifics maybe on what would happen, but were there any specifics on when they would happen?
No time frame in the Joint Declaration, except that one country, two systems would last only for 50 years. At first, I thought it would take place immediately, because the Joint Declaration was signed in '84, but to take effect in 1997. So I thought we could already set in place democratic elected legislature during that time, at least have everything ready, all right? But then the Basic Law says during the first 10 years after the handover, we cannot have universal suffrage yet. But after 10 years, we could. So that means I thought we would just wait for 10 out of the 50 years. But now, it's already been postponed to 2017, even if it comes about. It's already 20 years down the road.
Okay, thank you.
That's all the time we have. Thank you. We're going to move over to Mr. Dewar for 5 minutes, please.
Thank you, Mr. Chair. And I want to ask a bit about, I think we've established very clearly that what Canada's role could be, what we've seen from other governments, UK, and clearly the historical relationship we have both with China and Hong Kong, and worthy of noting and reminding for the record how many Canadians are in Hong Kong, over 300,000. I want to ask Chair Ms. Fung a question about what's happening with people here in Canada. How can people help support what is happening, as well as other instances around the world where people are supporting? Because I think what we're hearing today is very important. And I really want to underline this point of view that this is about having good relations with China and being responsible actors at the same time. So I'd just like to hear from you about some of the things that are happening within the Canadian context, community, and how people are responding, as well as some other examples globally around how people are responding and supporting what I think is a very straightforward ask, and that is just the commitment to adhere to the 97 agreement.
Yeah, thank you for your question. Actually, within Canada, over the last 1.5 years, ever since the starting of the so-called Occupy Central movement, I can see that even within Canada, a lot of Canadians, particularly those people who are originally from Hong Kong, they are very, very concerned what is happening in Hong Kong. Because if you go back to before 1997, there was a wave of immigration from Hong Kong to Canada as well as other parts of the world. But after 1997, because people see that, oh, maybe there's not really that much change, so maybe we can go back. But now, over the last 1 year, we see another wave of immigration. And according to one of the figures that I have just obtained from Hong Kong, in 2014, 21,709 people applied for a certificate of no criminal record. And of course, this does not imply that all of them will immigrate elsewhere, but at least they are hatching political uncertainty in Hong Kong. And a lot of people within Hong Kong, they are very frustrated with the bad governance of the present Hong Kong SAR government, who are mostly handpicked by Beijing without any accountability towards the citizens in Hong Kong. And within Canada, over the last 1.5 years, a lot of young people as well as first-generation immigrants from Hong Kong, they have joined force with us to stage a lot of rally, public forum, as well as petition letter, in order to show the support towards Hong Kong. And we are also joined by Canadians who are not from Hong Kong. Say, for instance, we have the Canadian Federation of University Students. We also have Canadian Labour Congress and also UNIFOR joining us. And we also have the professors and also students from the academic circle joining us. Just very recently, we have 3 seminars in 3 universities. One at U of Waterloo, one at U of T, and then we also have, another forum with the non-Chinese Canadians. So you can see a lot of interest and a lot of concern have been built up around Canadians. And globally, there was also a network called the Global Solidarity for Hong Kong being set up ever since last year. And it consists of members from over 60 countries. And every day, people on Facebook, they just tweet out messages as what could be done all over the world in order to synchronize the kind of action, support action that we can stage for Hong Kong. And now we have members from, I think, of more than 60,000 people from different countries. And even up to now, they still continue with their organizing back in their country. So in Toronto, we are probably one of the most advanced organizations because we are the only city in the world that have joined the pop vote that was organized last June. And I see this kind of aspiration among Canadians here, and we hope that the Standing Committee will also take this into consideration and see what we can do in order to allow our citizens to understand better what is going on in Hong Kong.
Thank you very much. We're going to wrap up with Mr. Schellenberger. 5 minutes, sir.
Thank you, Chair, and thank you very much for your testimony today. It seems to me as if signed agreements do not seem to be respected. Not only do we see this in Hong Kong, but in Ukraine, where deals are made or documents are signed to be implemented somewhere down the road or not implemented somewhere down the road. So do governments sign the agreements only for photo ops and hopes that 10 or 20 years from now they'll be gone and somebody else can deal with the situation? Mm-hmm. Or are these are these things signed really with due respect that they should receive? What's your feeling on that?
When the joint declaration was being negotiated between the British and the Chinese governments back in the 1980s, if I can go back to Deng Xiaoping's words, what he said to Margaret Thatcher, he said that, well, to have an agreement under which we take back Hong Kong is not going to be difficult. I mean, he could simply tell the British, get out. But he says it won't be right unless it is supported by the people of Hong Kong. So he made it a condition precedent to the agreement. And now he actually got it, because at the time, Hong Kong people, some were very reluctant, others saw in it a possibility of there being a successful future for Hong Kong, even though many people, I suppose, in their hearts would have preferred some other means of settlement. I, for one, went along with that, but starting from day one of the joint declaration, I made it my business to hold China to every promise contained in it. Because to my mind, if you let one promise go, the whole thing may collapse. It has to be, everything is tied together. And that is why for all these years, I have done my best, at least try my best, to hold China to all these promises. Now, it could still work if Xi Jinping were to go back to Deng Xiaoping's actual blueprint. But one of the important premises is that the Chinese leaders must trust the Hong Kong people. How can you have one country, two systems when there is no mutual trust? But now the trouble is, although the Democrats in the Assembly, in the Legislative Council, have more votes every time there was election in Hong Kong than their opposite parties, they are simply ignored in the Legislative Council because their superiority in voter support outside the Legislative Council is not translated into an equal number of seats, or at least proportionate, because we have a very unfair method of elections because of these functional constituency type of elections, which still accounts for half of the legislature. And so the government keeps on ignoring the Democrats within the council. And that is the problem, and that has to be redressed. But I hope, Mr. Chairman and honourable members, I hope your support of Hong Kong would be non-partisan, because that is the case in the US Congress, and that has been the case in the UK Parliament. You are stronger when you are united.
Yeah, I would also like to add one point to your question here. Actually, late last year, when Britain tried to send a delegation to review the implementation of the joint declaration in Hong Kong, the Ministry of Foreign Affairs of China publicly announced that the joint declaration was no longer in effect beginning from July 1st, 1997. Now, what that implies is that, China does not, honor and respect what they have promised before. And if the international community, including Canada, remains silent about this, then how can we trust that whatever agreements and contracts we sign with China in the future will be honored? I think we need to pay attention to this kind of pattern, because it will also have an impact on Canada in the future.
Mr. Chairman, may I correct that? I hate to do this to my colleague. The statement was made by the number 2 in the Chinese embassy in London, saying that the joint declaration is no longer effective, meaning that China already got Hong Kong back. All right? But that was not an official statement. I better put it on record.
Sure. Okay, thank you very much. And to my colleagues, thank you very much to Ms. Fung and to Mr. Lee. Thank you for the testimony today. You've given the committee some things to think about, okay? Thank you. With that, meeting is adjourned.